Welcome back to Primetime News, and a special welcome to those of you watching on onespotmedia.com. Jamaica is now in a serious situation as hospitalizations are at an all-time high. That's according to Health Minister Dr. Christopher Tufton. However, Dr. Tufton says provisions are now being made for additional bed capacity in order to meet this demand. Shamala Pullen has the details.
More than 80% of bed spaces are occupied at public hospitals as the country continues to grapple with an increase in COVID-19 cases. Speaking at a media briefing on Thursday, Health Minister Dr. Christopher Tufton says this is worrying.
Currently, some 309 of the approximately 362 COVID-19 beds across the island are occupied, making the occupancy level for COVID-19 beds the highest it has been to date at some 85.4%. So occupancy of our COVID wards, these are wards that we constructed in the early days of COVID back in February, March and beyond.
Dr. Tufton also said that the field hospital that was donated by the U.S. government and was installed at the National Chest Hospital will be relocated to the Spanish Town Hospital because that facility is overwhelmed. The health minister also said that additional beds will be available at two field hospitals built at Falmouth in Trelawney and St. Joseph's Hospital in Kingston.
We have 362 beds now at an 85% capacity. We're adding an additional, over the next few weeks, 133. So that would be the 72 from the two built-out permanent structures, the 21 additional at St. Joseph's, and the 40 from the field hospital donated by the U.S. government, which would give us now an additional 133 plus the 362. So we would ultimately have some 495 COVID beds, which would represent approximately a 35% or so increase.
In the meantime, Dr. Tufton says the issue of staffing for the field hospitals remains a challenge. However, that is an issue the health team is working to fix.
We are making arrangements to deploy and to redeploy. We have some recently minted nurses who are going to be accredited or certified by the Nursing Council. We had some doctors that we had brought in, 121 late last year. So there are arrangements that are being made, but it's still a very challenging period because there's also downtime from the existing personnel for one reason or another.
Shamala Pullen, TVJ News.